So I would like to start. Um, it's a very yes. So happy New Year to all of you. So let me just briefly tell you what today's topic is and what kind of discussion are we planning. So today's topic is on oral and maxillofacial surgery and the what recent patterns and what kind of questions they have been asking in recent days from OMFS. Okay, so I would like all of you to communicate me through the chat box so that there is no disturbance while I'm talking. So any doubt is there, anything you want to ask, you can message me in the chat box. And so firstly, I would like to start the session by wishing you all a very, very happy 2021. So today is the first day of 2021 and we all have jumped or rather survived 2020, which has been a very different year all throughout. Owing to the COVID scenario, we all have been staying at home. The lectures have been reduced, the lecture has been reduced. So everything has suddenly changed in 2020 and we have very good hope for 2021. So very, very good. Let it be a very good year for all of us. So happy New Year. And as we jump from 2020 to 2021, make sure you have an aim of what you're going to do in this coming year. So all of you are NEET aspirants who have gathered here. So make sure you have a focused and you have your mind is oriented towards the next year's exam and you're going to crack it at all costs. So let this be a very good beginning. So this year we are starting with a discussion. So our discussion today is on NEET MDS exam and pertaining to the oral and maxillofacial surgical or the OMFS questions which has been asked. So I'm not covering INI CET pattern now. I'm just talking about how the NEET MDS pattern were for the last 3 years. And at the end, we will discuss few questions. And I would like to, explain how easy actually it is to study OMFS and how to, analyze the questions and how to come to a conclusion, whether this is the answer or that is the answer. So we will just talk about all those things. So what is there in today's session? Key topics which has been covered in recent exams or which has come in the recent exams. So we should always know the recent trends. There is no point studying the All India and questions of 2000, 99, 98 and all. It is not asked at all nowadays. So there is no point in reading all old stuff. So you should be updated about what happened in the last. Okay. Without knowing what happened in the last 3 years, there is no point in studying throughout, the whole textbook or the whole syllabus won't help you unless you have focused on the key areas or the key topics in the recent papers. Okay. So I will also tell you, or I'll just give you a tip on how to read or study for OMFS and some few recent questions, some 3 or 4 questions I'll be discussing. Okay. So that will be today's session. So it will be a very short one. So regarding key topics, what do you mean by key topics? So entire syllabus is there in front of you. Okay. So there is a syllabus copy which you can download from the DCI website and your respective university, whichever university you have studied, may it be Rajiv Gandhi University of Health Science, Maharashtra University of Health Science, Kerala University, any particular university has a different set of syllabus copy, but then the NEET exam comes from the Dental Council of India's syllabus copy. It is available in the DCI website for download. So that is the topic or that is the entire syllabus. Now, what do you mean by key topics? So the key topics are the recent areas from where the recently picked questions or 3-4 years papers, what all questions they have or what are the areas from where they asked. Okay, that is very important because you need to emphasize more on these things. Okay, I'm not telling that the questions for the next year will come from only these topics, but I'm telling you to emphasize on these topics first, then move on to the other topics. Okay, so what are these topics? What all things had come? Cleft lip and palate. Yes, there are many questions which have come from cleft lip and palate. So it has come from its anatomy. It has come from its epidemiology. The treatment aspect has been asked. So the cleft lip and palate has been, popping up in recent papers. Trauma, and in trauma they have asked about orbital floor reconstruction, some incisions like canthal incision. So they have gone a bit depth, and mandibular fracture. Always they ask about mandibular fracture. They also asked about the plating systems in mandibular fracture. So trauma is a favorite part. It has been a favorite part in previous all India pattern exams also, and in NEET also. So trauma comes, and sometimes it comes a bit more than what is required for a BDS level. So then the most important one and the neglected part is the minor oral surgery. There has been a lot of questions from minor oral surgery, including the injection techniques. Even this year also injection technique has come. The sutures. Last year there was a lot of questions from sutures, medically compromised patients. A lot of questions on management of medically compromised patients. I think in 2018 three or four questions, same topic. Imagine you have left that topic, or you have not. Your surgery, few questions have come. That also is a part of minor oral surgery. So that is a very key part. Never miss questions from minor oral surgery, and most of the questions are the ones which we or are regarding the one which we surgery. Keep in mind, it's very important. And recent trend, this is we are not very sure whether it's coming from the oral surgery side or from the prosthodontic side, but implants has been asked in recent days, and there are a lot of picture based questions also being. So it is a question from prosto. These were the key topics in last 3 years. So these last 3 years topics, you should read first. Okay, you should read first, and then you should move on to the rest of the syllabus. Okay, your surgeries which you might not have seen, that might be the trauma cases. Some of the trauma cases are like the questions they have asked are of PG standards and all. So there are a lot of things to study in oral surgery. So how to read or how to study? What I say is, collect the previous questions first and find out the areas, just like how I described the key topics. Find the key topics and read those key topics. The reading, it should not be like how you read for your descriptive pattern exam. Find out points, just the points which can or which they can ask us a question, and memorize those and make a small note for all those things. Okay, don't spend hours and hours digging in big textbooks. Instead, spend quality time reading the old question papers and find out relevant topics, or read relevant topics which you feel that you are not very good at, or which you feel that I don't know anything about this particular topic. Those topics you can just refer some textbooks which you feel it is easier for you to understand the topics, rather than mugging up all the stuff. You can have a slight bit of understanding that will make the things easier for you. So don't start with textbooks. That's the common mistakes you make, whether for oral surgery, anatomy, or anything. Don't never start with textbooks. Start with previous questions first. Then you can choose whether you have to read a textbook or for this particular topic. you listen each and every other time when you're revising. Then search for the topics which you want to actually read, and then read only those particular key topics or particular topics which you actually don't have any idea about. Okay, so as far as possible, stick on to the previous year's question papers and what stuff they have asked. Okay, after you have completely done with the previous year's papers and all, you're good with it, you can spend some 2 or 3 days time reading the textbooks and all, noting down few extra points. And reading textbooks is very helpful when it comes for your pictures, because the pictures are directly picked from some textbooks. So, but otherwise, I would never tell you to start reading the textbooks first. Okay, so stay focused with what kind of questions has been asked. Then you check in the textbook for similar patterns or similar areas where the similar pattern questions can be or may be asked. Okay, so that's how you do it for any subject. So surgery also you do like that. Okay, and some instruments and all, if you don't understand what the instrument is, try to search for a picture or try to search for some clinically relevant things which will help you to understand how this particular instrument works, because those things, if you see once, it will stay in your mind and study. I'll just show you one of few questions which has asked in recent days, and I'll tell you how to read and how to relate to that. Okay, in this year's question, this year's paper, identify the instrument in implant kit. Okay, so this was the question they had asked. So when such question comes, you don't just by heart what this picture is. If they have tilted the picture, or if they have rotated the picture, then you will get confused. Next time the question comes to the picture which is rotated, you will get confused. So don't by heart the pictures. Rather, I'll show you the area. You should be able to identify and know what all other stuff is related to this particular instrument or this particular area. So this is a picture in which there's an implant. Obviously, there's an implant in the patient's mouth, and onto which some attachments have been kept. Okay, so think what it can be. So it can be can it be an attachment to which the crown sits? Can it be? Anyone? Can you message in the answer and the chat box? What do you think? What kind of stuff is it? So something is kept extra onto the implant which is lying inside the bone. Anyone? Any guesses what this can be? You can type in the chat box. Okay, I'll just explain it to you. I think the problem is that because this is a this is a part, implant is a part which is not you might not have the clinical exposure, or you have seen this, or you might actually have not read about it, because it is not very relevant or important in case of your normal BDS curriculum. So I'll just draw and explain few stuff from this. So suppose this is a bone block. Okay, so what do? We place an implant. Okay, what we do is, I'm just showing you, I have drilled a hole like this. It will be something like this, isn't it? So the implant is within the bone. This is the first phase. Next, what I do is I cover the gingiva. I put two sutures. I put two sutures here and there, and then I send the patient. So this is what we do in the first sitting of implantology. You drill a hole, so it is called osteotomy. So you do the osteotomy and then you implant in. Okay. Next, what do you do? The patient comes back to you after 3 to 6 months, depending on what kind of bone. So based on healing, we plan for a, there will be a small screw which will go inside like this. So there is a cover screw there. And next, what you're doing is when he or she comes after 3 or 4 months or 6 months, whichever time period you have planned, you will remove the gums. You will open it. Then this particular screw here, you will unwind and remove it. So I am removing the screw. So it has been 6 months, and now what I do is I place something called a healing cap. So healing cap is like bigger screw which goes into this and tighten it. And what does the healing cap do? A cap will allow the gums to heal. So the gums will be around the healing cap like this. So gums will heal. And it will heal in such a way that it helps in forming the emergence of the crown, which we are going to place later. So this is what is healing cap. So told healing cap. So healing cap is a very small thing. It will be slightly above the gums. So somewhere of this height, just have a look at this picture. Somewhere of this height only the healing cap will come. Okay, very small one. So it will be something like this, projecting out, so that the shape of that gums is maintained. Okay, so that is something called as healing cap. Now after healing cap, what we have to do is some 10 to 20 days or 10 to 15 days, the healing cap is placed, the gingiva is round or contoured now properly. Then we will do, what we will do is we will take a impression, or we will make an impression of that particular area. So what we do is we place something like this, 2 posts. You remove the healing cap and you place there are 2 implants in this particular picture. So I have placed, or I have shown the picture with 2 impression posts. Okay, so what I have shown in this picture is impression post. So how does it work? When you're taking an impression, this is getting transferred in the impression, you can place an abutment and then you can fabricate the crown as you normally fabricate for any normal crown preparation or normal crown. Similar way, this abutment they can use in the lab, and they can mill the abutment, shape it, and onto the abutment. This is, got it? This is your healing cap. From healing cap, you move on to, you remove the healing cap, place the impression post, then, or impression post, or it is also called as the transfer copings, and then you can make an implant analog. So this represents an implant, or this is going to replicate your implant. The your laboratory works is carried out. So you have an abutment fixed onto it, and then onto it the crown. So these are the various other associated picture based questions which they can ask. So you club and you take everything together, understand the concept, then you can try to solve the new question. Implant is an area where you have no idea. So try to collect the idea, and when you go through the pictures and when you understand that, okay, these stuff are these, it is easier for you to answer these questions. So I'll just show you the answer. It is torque wrench racket. Now I didn't tell you what is torque wrench yet. So what is torque wrench? So it carries a driver and the implant is driven inside using the torque wrench. So what do you mean by driven inside? So when I drew the picture, I told you that into the bone we do an osteotomy and in which the implant is kept. So you have to drive it in. You have to drive it in. So you have a driver here. You can use your finger. Initially, you can use your finger, but once it gets more tight or more resistance is felt, you can use this thing. It is a wrencher. So it helps you to, you can wrench or you can drive it inside with the help of this wrencher. Now, why is it called torque wrench racket? Now, the torque wrench means you can set the torque. If you can see in this picture, 0, 15, 25, 35, 50 and all. So what is it meant or what does it mean? So it means that you can see how much Newton of force you are applying. So torque wrench helps you to identify how much of force you are using or how much of torque you are using to drive the implant inside. So that is a torque wrench racket. So what I am conveying you or what I am telling you is, you get this question, you should always study few things which is related to this particular question also. Then only this question also will remain in your mind. Okay, don't just mug up this question and move on. Study some key topics related to it. And when you have an exam which is coming after 11 months, you have got time for doing this. When you're doing a crash batch, you have only 4 or 5 months. You cannot do all these things. You have to just mug up and you have to study whatever extra 2 or 3 points which you get from some MCQ text guides or some materials from entrance coaching centers and all. But right now you have plenty of time. You can research and you can find out few pictures from whichever textbook or whichever the simplest book. Don't go for a big book and all. Try to collect data from the simplest book, and that should help you to retain or remember whatever you have studied. Okay, only studying that particular question won't help you to recollect it. Okay, so you have to read few topics regarding this. Okay, so we just discussed about impression pose. We did talk about healing abutment, and now this picture shows the picture here shows the implant analog within the cast which has pone, and this is the implant, this is the abutment, and on to which the crown is there. Okay, so all these things we have just discussed. So this is how the torque wrench actually works. So there is an implant, supposedly it's somewhere here, it is inside the bone and we are driving it inside. Okay, so clear? So this is how you should be studying this particular question. Now we've shot the second question. Okay, so I'm not here to teach you more questions. I'm just here to teach you that learning method of these questions. And this also was asked in the recent paper. Recent paper means the paper which was there 15 to 20, 16 days back. Okay, that was on December 16th we had a exam. So this is from those paper. The previous question also is from that paper only. So here they have asked, cleft lip occurs due to the failure of fusion between. Okay, what is maxillary process, what is mandibular process, what is maxillary process, what is median nasal process, maxillary process, what is lateral nasal process. We should know all these things. Only then you can answer. Okay, so I'll just tell you or I'll just teach you how the formation of face takes place. So we have a, suppose this is a face. Okay, suppose this are the ears, so these are the eyes. Okay, and you have a lip, isn't it? Okay, this is just a diagram for representation. So this is the face. Now, what happens during the development of face? So you have a nose which is like this, and now what happens is there are many processes which together helps in forming the face. So it takes place, the development takes place around 4 weeks to 6 weeks of intrauterine life, and the face, the palate, all those things, simultaneously it is being formed. So what happens is there is something called as frontonasal process. So the frontonasal process is the prominent process from the cranial end, which comes down, and the part which forms the frontal region of your face and all is developed from frontonasal process. So as the name says, it is frontonasal process. So what is this nasal process got to do here? So the frontonasal process divides into the median nasal process and the lateral nasal process. So the green colored ones which I've shown is the lateral nasal part, which is derived from the lateral nasal process, and the central slightly yellowish colored one is derived from the median nasal process. Okay, so understand this thing. You have the frontonasal process which divides further into the median nasal process and the lateral nasal process. Clear? So you have a median nasal process which I have marked as yellow in color. So the area which comes in that yellow color is the area which is derived from the median nasal process. So that includes the middle part of the nose, and also very important, the philtrum of lip and the part of upper lip. Okay, so that is one thing you should know. Another thing which you should know is the maxilla is similarly, the maxilla is developing from a process known as maxillary process. So what is this maxillary process? This maxillary process is part of the first brachial arch. What is the first brachial arch? The first brachial arch, there are pharyngeal arches, first, second, third, fourth, out of which the first brachial arch, it divides into the maxillary process and mandibular process. So mandibular process is the process which I have marked with this dot, which forms the lower, the skin over the lower part and the lower lip. So this lower lip and all derived from the mandibular process. So whereas the upper lip and the cheek on both sides, it is derived from the, this much of area, it is derived from the maxillary process. So now we have just talked about some processes other than the median nasal and lateral nasal process. What are those? One is the maxillary process, that is in pink color. So you have a maxillary process which is in pink color, and the mandibular process which I have marked as the black dots. So the area in this particular region is developing from these particular processes. So this is how the face develops in brief. So you have the frontonasal process which divides into median nasal process and the lateral nasal process. Now, what is the question which is asked? Cleft lip is due to fusion of which particular processes? So can any of you tell me? So can any of you tell me what is the question? So the failure of fusion of which processes can lead to, or it may lead to the, yes, Dr. Sarah, maxillary process and median nasal process. So you are right. So others, are you listening? So what actually happens is this particular area. I'll just um, mark in a brown color so that there's a contrast. So this is your cleft lip, isn't it? So the brown colored part is your cleft lip. So it is actually, this is your cleft lip. It is actually the medial nasal process and maxillary process. So this should be clear for everyone. Now we will move to some other question. Suppose, okay, suppose I'm putting contrasting color again. Suppose there is a fusion, failure of fusion in this region. Which particular processes are involved? Can you just comment in the chat box? Maxillary and lateral process. Yes, you're right, Gayatri. So what kind of cleft is it called? What kind of cleft is it called? Anyone? Do you know what kind of cleft is it? So it is called as a oblique facial cleft. So the blue colored one is called as the oblique facial cleft. Got it? So what happens here is there is a cleft which lies along the lateral border of your nose. Okay. So that is another type of cleft. And another question they may ask you is regarding transverse facial cleft. Now, what is transverse facial cleft? Anybody knows that? Sometimes what can happen is, yes, you're right, Adra. Sometimes what can happen is the maxillary and the mandibular processes, okay? The maxillary and mandibular processes might fail to fuse in one side. So what it can lead to is there can be an extended cleft in this region. So the lip there might be a cleft towards one side. So that is known as transverse facial cleft. So we studied about three things. So first one is regarding the normal facial cleft where the maxillary and the median nasal process is not fusing. So second one is the oblique facial cleft in which the lateral and the maxillary process is not fused. Third one is the transverse facial cleft in which you have the maxillary and mandibular process which has failed to fuse. Okay, so that I hope is clear to all. I shall move to the slide. So this is in brief just have a look. Okay, just have a look. This is from 5 weeks onwards. Before 5 weeks itself, the journey or the phase development. So just follow the spotlight here. So this is the frontonasal prominence. See how the median nasal and lateral nasal process are, separated, and it is in the other two. I mean, it is in the opposite sides, and later the frontonasal prominence in between this lateral and median nasal process, it's going to shrink in size, and this will come, and finally this median nasal process is going to unite, and finally it is going to become like this. The philtrum is formed from the median nasal process, then the lateral nasal process is on the sides, and the maxillary process is here. Okay, so I hope that's clear. So we have the answer also here. I think most of you have already understood which was the answer. So maxillary process and median nasal process. So next, how to study from the options, or how to when you're revising or when you're reading again, or when you want to study this, so you should check all the options. The first option, what will be the answer for first option? Maxillary process with mandibular process. If there is a failure of fusion, can you please comment in the chat box? What will be the answer for A? Or rather, what will be the question? What happens? Yes, exactly. Transverse facial cleft. Very good. Now, what about the option C? You can tell me the answer. Option C. What kind of cleft? It will be oblique facial cleft. Very good. Now option D. It's very rare. But still there can be a, there can be a notching in the nose. So at least when you read the options now, you can picture of what it actually means. So that's how you should read and study. Okay, don't just mug up the answer and go. Again, a question in this year's paper. It is coming from the same region, cleft lip and palate. Okay, pre-maxilla is found from, and this can be also a question which has been asked from the embryology part also. Okay, so what is pre-maxilla? I'll just show you, Mark can show you what is pre-maxilla. Just very easy to understand once you have read the previous topic. So this region of maxilla is developed from which process? That's what they are asking. This region is known as the premaxilla. Okay, I will somewhat like this. Yes. Shubham, there is nothing like median and lateral nasal process. If at all it happens, it may lead to a nasal notching. Okay, so that is not a relevant question. So other three options are very relevant, but I'm just telling you, if at all there is a median and lateral nasal process failure, it's going to give a notching in nose. So there is no question which has asked like that. There is nowhere in the theory which they talk about notching also, at least in our textbooks. So I was just telling you, if an option comes like that, that is how you should think about it. Okay, when you get a picture of it, how the development takes place. Now you can imagine on your own. Okay, median nasal process is this region, lateral is in the. If there is a failure, there should be a notch in somewhere here. Okay, so there is no question asked like that. Okay, so coming back to this one, so the area marked under red is the area which is developed from your median nasal process itself. Okay, so the median nasal process along with the median nasal process is going to what do you say, give rise to the philtrum of lip skin over here, and inside it is going to form the premaxilla. So what was the question here? The question here was premaxilla is formed from. So premaxilla is formed from median nasal process. Okay. So now we have studied, connecting to our previous question. We, you have added one more point to it. You have added that the premaxilla also is derived from the median nasal process. Apart from the central part of nose and the philtrum and upper lip, the median nasal process also gives rise to the anterior segment or the canine to canine region of your maxilla. Okay, so and along with this kind of question, you should revise the other areas which are developing from this is a premaxillary region. Sorry. So this is your premaxillary region. Now it leaves us with two palatal shelves. So this is one palatal shelf and this is the second palatal shelf. So this is derived from the maxillary process from both sides and it fused in the center. So if you want to really connect and study, you should study this along with the development of palate also. Okay, so that's a way to connect things and study. You should also connect this to the previous question which we just discussed. So there were two questions regarding the development of cleft lip and palate and the development of or particularly the embryology part of cleft lip and palate. There were two questions last time. Okay, so never neglect the basics. So the premaxilla will be developed from the median nasal process. So it is nothing. This area in the front. Sorry. Those who didn't understand this area in the front, which I have marked within this red color, is called as the premaxilla. In development of phase, this premaxillary part is developed from is originating from the median nasal process. So MNP gives rise to this simple thing. And what about the rest of the palate? So you have a palatal shelf which comes from this side. You have a palatal shelf which comes from this side. So this is your palatal shelf. So this is your palatal shelf. So this comes from maxillary process. Okay. So both sides, the maxillary process is going to the maxillary process is going to come from sides and it is going to unite in the central sutural region. So this is the central sutural region. So this is the development of palate. Okay, I want to go into detail of the development of palate. That's why I was just I was not trying to teach you stuff here. I was trying to tell you how you should be connecting things. Okay, how you should be connecting same question or similar question which has been asked from the similar part. Okay, so I was just trying to convey that. Okay, we can discuss the development of palate later on. So but here just know that median nasal process we had already studied in the previous question, and there is also a question which has asked now coming to this question, very clinically relevant question which was asked in this year. So I think one more last question which I would like to discuss. No, again my point is when you're having a question regarding the local anesthetic technique, you should also know about other local anesthetic techniques, and it should not be like how we study for our regular exam or regular descriptive pattern. You should look for particular area from where they to correlate what they have read on. They cannot correlate. So we would have read that Gaugates is the injection. It is given in near to the condyle, or something related to the condyle. So all those things we might have read, but when the picture is shown, they will not be able to even understand whether it's condyle or coronoid. Okay, so that kind of block will come when they put a new question or new picture based question. So to avoid such things, you should always, whenever you are reading something, you should always imagine, okay, this when they're telling that you should palpate for the coronoid notch, you should remember, or you should train your mind to visualize which is coronoid notch. That will help you to understand what kind of question they have asked, or if there's a particular question, uh, if there is a particular question which was asked uh, based on the picture which is given, if you want to correlate it, you should have an idea. Whenever you're reading, you should train your mind to visualize it. Okay, so now I will just cut this thing, and I will just cut the question, and I will simplify the question. Okay, now the question is, the area where they have asked is an area in the condyle. Okay, and this area is particularly area very close to the pterygoid foveae, where the lateral pterygoid muscle is attached. Okay, so basically a injection in that condylar region, pterygoid foveae region. So the injection at that height is only a Gaugates injection. So most of you might have done it. Some of you might not have given such injections. So I will just tell you an easier way to study. So now there is a mandibular foramen. This is the inner aspect of the mandible. So now you have a nerve which. So what is this nerve known as? Anyone, can you name this nerve? What is this nerve which goes inside? Yeah. So this is the mandibular nerve. This what I've drawn in thick one is the posterior trunk of mandibular nerve. And there is a posterior larger division and there is an anterior smaller division. You might remember that. There is a lingual nerve which goes somewhere like, which is a smaller nerve which goes somewhere like this, very near to third molar, and it comes down here and it loops around the loops around your Wharton's duct. Okay, so that is your lingual nerve. That is a branch of your, the lingual nerve is a branch of posterior larger division. The anterior smaller division, it will be somewhere here. It gives branches to the muscles, and there is a branch which loops down and comes onto the buccal aspect like this. That is your buccal branch. So we will talk about the anterior branch later. Okay, so now this is the mandibular posterior division. So I will mark certain points. Now there is a red point which I have marked. So that is the area or the target area which they have asked in the question. So that is the area where you give Gaugate's injection. Okay, I think Anaga has answered it. You're right, it is Gaugate's injection. Now what about this area? And what about this green colored area? So can you tell me, injection is given in the mid ramus? Yes, which is given in the mid ramus, blue colored. Can you tell me which injection? Yes. So few of you know this, few of you don't know this. So understand this point. Your Vasirani achinosi is given in that blue color region. Your IANB, inferior alveolar nerve block, is given in that green colored area. So what point I wanted to teach was the height of injection. The first one is Gaugate's. So the height of injection is at the level of your condyle. Okay, second one is in the mid-ramal region. That is your Vasirani achinosi. And the third one is inferior alveolar nerve block. That is a point just before the nerve enters the mandibular foramen. Okay, so understand this. So any picture-based question, if they are asking regarding the position, or if they are asking regarding which nerve block targets a larger nerve trunk, among these three, can you tell me which nerve block targets a larger nerve trunk? Gaugate's, because you know what actually happens in Gaugate's, the lingual, the mandibular posterior division, the auriculotemporal nerve, all these things are blocked in Gaugate's. Okay, so the before that division takes place, the Gaugate injection is given. Now, what about Vasirani achinosi? The lingual is covered. The lingual is very near to that region. It's not this separate as I've drawn in this picture. And there is one more nerve which is anesthetized in Vasirani achinosi. You know what that is? Anyone knows this nerve which I'm going to draw here? So I'm drawing in a contrasting color. Anyone knows that nerve? No, hypo is a different nerve altogether. Hypoglossal nerve is a different nerve, not related to mandibular nerve. It is mylohyoid branch. Lingual is anterior Swarup. Lingual I have already drawn as yellow color. The mylohyoid nerve is splitting just before the inferior alveolar nerve enters into the foramen, and it goes below the mylohyoid ridge, which is you can see the ridge there. So the mylohyoid nerve also is blocked in Vasirani achinosis. So when it is Gaugate's, the nerve trunk will be more bigger because the branches, there are only few branching which is taking place there. When it comes to Vasirani achinosis, it will be slightly more bigger. When it comes to INB block, nerve will be still smaller. Okay, there is comparative charting. Okay, between these three. So this one question you should cover all these aspects, and all those nerve block, all okay. So this is how is coming from the LA or injection aspect, and also you can study about the any adverse reactions of LA. You can read about the volume of local anesthetic material you use for injection, or all those value based questions which comes from the nerve blocks side. All these things should be clubbed together and studied. Anytime you're getting or reading a question, you should recollect all these things. That's how you revise. Okay, don't I've seen a lot of students, they revise by making new notes. They revise by reading. No, you don't revise by reading. You revise by recollecting. Okay, you do questions, try to recollect as much as points as possible. After that, you can just refer the question textbook or refer your notes, and you can find out which all points you had missed. Okay, so there is no point in reading and reading and reading. You should read, recollect, then read, recollect. That's how you should do it. Okay, so I think those are the only few questions which I wanted to discuss. So my understand the answers. I wanted you to find a way, or I wanted you to utilize this message which I was trying to convey, that you should try to incorporate, you should try to incorporate other questions, other important points. Don't just study one question. Okay, studying one question should be in such a way that you cover all the 10 related questions which comes from that particular region. Okay, so that's how you should be reading. And in OMFS, understand the procedures. Without understanding procedures, if they say a particular name of procedure, you should at least know this is done for this thing. Okay, don't ever mug up, because at the end of the session, when you go exam, it is going to create a lot of confusion for you. So when you know a bit of what is being happening, or what you're doing, or what the procedure is, like I've shown you torque wrench, and I've shown the picture in which the torque wrench is being actually used to drive the implant inside. So similarly, you should have some idea of what is being portrayed. Okay, that will help you a lot. Okay, so with that, I'm just concluding this short session. So anything you want to ask? No, this is not a question, not a session for you to learn the particular 3 questions which I've given. No, that question and all you can learn. You should find a way to, I'm trying to formulate you a pattern of study. So understand how you should develop your pattern of study. And the mistakes which many people make is they don't have a definite pattern. Okay, your pattern, if it is good, you should be able to recollect properly. If you're not able to recollect properly, the pattern of study is wrong. So identify your shortcomings, and then you should reformulate, remodulate your pattern of study. So that's how the entrance curriculum goes. Okay, so with that, I'm concluding my session. Anything anyone wants, or any doubt is there, you want to type, just type in the chat box. So that is a big thank you from me. Thanks to all for the patient listening, and have a very great year ahead. So anything more? Hope the session was helpful for you. Yes, thank you all again. Have a great time ahead, and don't miss any of these orientation sessions. Tomorrow we have a very good faculty coming up. Dr. Shrestha will be coming up with dental materials. So stay tuned. 8 p.m. we will guide you, and we will make sure that you are oriented towards your aim. So keep and write down your aim, whether you want MDS in orthodontics, MDS in oral surgery. Write it down, have a plan, and study properly. Okay, all the best, and good night to all of you.